Hi, everyone, and welcome to episode 112 of the Veterinary Behaviour Chat podcast. And today we're going to do a bit of a deep dive into feline human directed aggressive behaviours. And there's a couple of reasons that I wanted to do an episode on this. The first one is I actually had a request from a listener to do an episode on this. I think it's from a veterinarian who actually has a mobile practice and sees quite a lot of cats and does on occasion see this. And then the other reason is because I actually saw a case myself just this past week where we had both inter-cat aggression, but also feline human directed aggression as well. So it is kind of a topic that I have been thinking about a little bit due to my most recent case, but also something that's come up as a listener question to do a topic on. All right, let's dive into it. So as many of you know, I actually see quite a lot of cats here in the UAE, a lot more than perhaps many of my colleagues might see elsewhere in the world. And I mean, I'm not going to say I see 50-50 cats and dogs, although maybe, but probably something like 40% cats, 60% dogs. So I definitely see a lot of cats. And while inter-cat aggression and urinating outside the litter box are probably sort of the top two behavior presentations that I would see, I think human directed aggression is quite closely followed on in third position there. And so I wanted to today just kind of dive into a little bit the differential diagnoses. So the different things that we might consider as causing factors or as underlying factors for aggressive behaviors towards people. How can we identify them? How can we pick things apart? What are the kind of questions that we need to ask the caregivers so that we can actually start to sort of narrow in on our diagnosis? And then also, what would I consider doing to treat these cases? And I think the first thing I'll say is that living with a cat that is aggressive towards people can be as distressing as living with a dog that's aggressive towards people. So cats can absolutely cause some very intense damage, both physically, but also if you've ever had a cat that's sort of been aggressive towards you. I can remember myself, actually, one of my really early cases, early on in my residency, I think like within the first, probably the first 50 cases I saw. So really early on, I saw a cat here in Abu Dhabi that was really aggressive towards people. And I did a home visit and I actually kind of came face to face with that aggression. We were having a tour of the home. I was looking around the home and we were upstairs in one of the corridors and the cat kind of got very highly aroused at me being there and started to make signs that they were going to launch themselves at me. And that is not a nice feeling. So we ended up sort of managing that situation by putting some barriers and then kind of going into a different room, closing the door. And, you know, and that cat, and we'll talk about a little bit what the signs are when we have that sort of very offensive, aggressive behavior, you know, what are the signs to look out for? But that was not fun and it felt really uncomfortable. So, you know, thinking about living in the same home as a cat like that, especially when those aggressive events can be somewhat, I'm not going to say unpredictable, but they can happen quite quickly. They can escalate quite quickly. That can be really scary. And then obviously also the level of physical injury that cats can cause can be really extreme. So whether that's with their claws or with their teeth, we know that cat bites can cause really severe injuries to people that oftentimes need, you know, hospital care, sometimes even emergency care. You know, deep cat bites can cause severe infection that really needs to be treated quite severely with intravenous antibiotics sometimes. So, you know, they can be really quite severe. And also, you know, injury with their claws, if they kind of grab onto you and injure with their nails and their claws, all of those things can be really quite traumatizing if you're on the receiving end of that. So, you know, definitely cat or feline aggressive behaviors are to be taken as seriously as canine aggressive behaviors for sure. So how do we start to kind of dive into what is underlying these aggressive behaviors, what is contributing to them, what is causing them? Obviously, the first thing that we always want to think about is there any physical health, any underlying physical health challenges? And this is always particularly at the top of my mind if we maybe have an older cat where there's been a sudden change in behavior, a sudden onset of aggressive behaviors, maybe together with some other behavioral changes, then I would always be wondering about, do we have pain, chronic pain? And then in cats, a really big one can be hyperthyroidism, so elevated thyroid levels, which is something that we do see in cats, especially slightly older cats. And that can really cause this change in temperament towards this irritability, impulsivity, and that can then come with aggressive behaviors. So, of course, there's a whole host of other physical underlying causes that there can be. And, we absolutely, as a first port of call, especially in a sudden onset behavior, sudden change in behavior, and maybe even in a slightly older animal, although also in younger animals, we want to be looking for physical health causes. And when I talk about pain, yes, it absolutely can be musculoskeletal pain, but this could also be pain from other areas. We know dental pain in cats can be really significant as well. Again, we could potentially be thinking about gastrointestinal pain or discomfort, perhaps dermatological pain or discomfort, and then all the other organ systems, neurological disease. We potentially are also thinking about viral infections in cats, so FIV, FELV, maybe other infectious diseases that can cause maybe neurological signs. I'm thinking toxoplasmosis here, but there are a whole host of other things that we could be diving into. But just think pain and hyperthyroidism might be sort of two big things to think about, plus obviously all the others. So once I've thought about physical disease, my next question then usually is this affective, i.e. emotionally driven aggression, or is it predatory behavior that is being inappropriately directed onto people? So if it's emotionally driven, then we're thinking about things like fear, anxiety, frustration, perhaps, versus this kind of relatively normal predatory behavior for cats. However, rather than it being directed onto a prey species, I don't know, a mouse or a bird or a toy or something, it's actually directed onto humans. So that's always my first question, especially maybe if we have a very young cat. So if we've got a young or an adolescent cat, a cat that is maybe, I don't know, around the sort of 12-month age mark, and we have, aggressive behaviors directed towards people, I'm always going to dig into, is this emotionally driven aggression or is this predatory behavior that has just kind of gone wrong a little bit? And the way that I often do this is I either ask to see videos, although we never ever want to encourage an aggressive event just so that we can get a video. But if the caregiver happens to have a video or maybe, a room camera that captured an event or something like that, then it's really helpful for me to see that, because oftentimes by the cat's body language and by the way that they are showing the aggressive in inverted commas behavior, I can oftentimes see whether this is maybe more emotionally driven or whether this is a hunting behavior. So what's the difference? If it's a predatory behavior, so if this is a cat that's hunting and is kind of directing that hunting onto people's ankles, feet, hands, whatever it might be, I would expect for that behavior to be quite silent, because predation in cats is silent. Imagine if they were being noisy whilst they were hunting, then that would scare away their prey. So usually that's pretty quiet and silent. You might see that really sort of typical hunting sequence that cats do, which is first they'll watch something, then they'll focus on it, then they'll perhaps, kind of stalk, then they'll crouch down, they might kind of wiggle their bums, and then they might pounce on something. Sometimes they grab and they kick with their hind legs. But all of that is relatively silent. And we don't normally see any other body language signs of high emotional arousal. So what do I mean by that? So on the other hand, if I think that this aggressive behavior is truly emotionally driven, I will be seeing signs of high emotional arousal. So that could be vocalization. So very much in contrast to your predatory behavior, affective aggression is oftentimes comes with vocalization. So you might hear hissing, but you might also hear this sort of high-pitched yowling, maybe before or during an aggressive event. You might see piloerection, so the cat being puffed up, maybe the whole body being puffed up or the tail being puffed up. You might see the ears rotating sideways. You might see the tail flicking if it's a sign of frustration. And you'll oftentimes see this very sort of jerky motion as they approach. Or you'll see this kind of moment of pausing and stillness with maybe puffed up fur, tail flicking, ears rotated. So that's what it was a little bit like with that cat. Remember I told you about one of my very first cases when I was trapped in the corridor. The cat came towards me, fixated on me, had his body slightly angled, fur was puffed up, pupils were dilated, ears were rotated back. The cat was vocalizing, kind of yowling at me. The tail was lashing, and I could see the body weight shift backwards as if he was about to launch himself at me. So that for me is truly affective behavior. There was nothing predatory or hunting or injurious play type behavior about that. That was really an emotionally driven aggressive behavior. So oftentimes that kind of identifying that body language and really asking the caregivers about the questions. What do they look like? What are they doing? Are they lashing their tails? Does their fur puff up? What can you hear? All those questions are going to help at least separate, do we have predatory or injurious play behavior here, or do we have emotionally driven behavior? Now, the one thing I will say is dilated pupils can be one of those which can really occur in both situations, right? So if we have kind of predatory or this sort of heightened, let's say, play behavior, hunting behavior, we can absolutely have dilated pupils. But also in emotionally driven behavior, we can also have dilated pupils. So these like big round pupils are not necessarily good identifiers between predation and emotional aggression, but a lot of the other things definitely are. So that vocalization, the piloerection, the ears rotated back, the flicking of the tail, that's usually one that's, you know, especially if that starts to get more and more intense, that is oftentimes a sign that something aggressive is about to follow. Now, speaking a little bit more about this kind of gone wrong predation, hunting, play behavior. This is the reason that we discourage playing with kittens with our hands and our feet, for example. So it can be so tempting when you have a kitten to sort of, you know, wiggle your fingers or kind of play with them with your hands. And when they're kittens, it's quite cute. You know, they might kind of grab onto your hand and kind of do a little bit of kicking with their back legs. However, as these kittens get older and they get more powerful and stronger and their behaviors become more adult-like, then all of a sudden we've got a behavior that we've kind of nurtured and reinforced. And now all of a sudden that's starting to become painful for us, and it's starting to become unacceptable, right? So even when we have kittens, we always want to discourage the caregivers from playing with them with their hands, or even like wiggling toes, right? Because those are usually, in my experience, when we've got these injurious play behaviors or predatory behaviors, oftentimes you'll have, you know, feet and ankles, calves being one of the primary targets. So the cat's kind of crouched behind a door somewhere. Caregiver walks past, cat pounces from behind the door, thinks it's, you know, a fun hunting game, and then is kind of wrapped around the caregiver's ankles or feet. And while perhaps many of us as adults, especially if we're wearing trousers, socks, whatever, could cope with that, if we have children in the home, or if we perhaps have elderly people living with us in the home, that then of course might become more dangerous and even more inappropriate. And then some cats, especially if they have very high prey drive or very high predatory behavior, and if they don't have sufficient outlets for that predation within the home, then that behavior can become quite extreme, and it can actually really become quite painful and quite injurious. And, you know, we've got lots of like claw marks and maybe even teeth marks. And the caregivers can really be quite upset by that. And obviously, if we then have children or perhaps elderly people in the home, that can become a problem. So those, once I've kind of thought about physical health, then my next question goes towards, is this affective, i.e. emotionally driven behavior versus predatory and hunting behavior? And if it is predatory behavior, you know, there's a lot we can do to kind of redirect that, kind of recondition that, provide more predatory outlets, maybe think about letting the cats go out if that is something that, you know, the caregiver's comfortable doing, and, you know, they're not living in an area of protected wildlife, or all the other sort of limitations that there might be. But oftentimes, if we can redirect that predatory behavior onto more appropriate and suitable outlets, then we can go quite a long way into treating that. Where it becomes more difficult is if we have this truly affective, emotionally driven behavior, because that can be quite intense, quite severe. It depends on the level of the cat's emotional arousal, what the underlying emotion potentially is, and, you know, and how do we then treat that in a comprehensive treatment plan, which I'll go into. But let me talk through a few of the underlying causes that might lead towards this emotional aggression. So obviously, if we have any underlying physical disease, and, you know, pain is a big one there, that absolutely can have an emotional component. So we mustn't forget, when we are ruling in or out our physical diseases, that even if we find a physical disease, let's say we do find hyperthyroidism, or let's say we do find musculoskeletal pain, we have to remember that those potentially have, especially pain, has an emotional component. So we might still be thinking about doing something to both treat the pain and to treat the emotional component that the pain has. So that can absolutely be one of the sort of underlying emotional states, can be irritability or pain as a result of, irritability or anxiety as a result of pain, discomfort, or physical disease. The second one would be fear. So a true fear reaction. Now, that could be fear of handling, it could be fear of strangers, it could be fear of unfamiliar people, it could be fear of other pets coming into the home. Maybe if, you know, a dog joins the family, it could be fear of maybe a new family member joining. It could be fear from environmental changes. So there are a number of things that can cause cats to be fearful. So one thing I see quite frequently is when visitors or strangers come in and the cats become fearful. Now, their first instinct is to go and hide, but then oftentimes they might either come out to investigate, and then within that interaction, they may then become aggressive as a way of being defensive. Or if they're encouraged by the caregivers, come out and say hello, come and meet the visitors. And then these cats that actually have taken themselves off to hide because they're scared, and maybe being picked up, carried out, you know, put onto the lap of the visitor. And that's then when they react aggressively, because that is the only way that they can then defend themselves. So fear is definitely one that I would say is quite high on the list. And when I'm thinking about fearful cats, I do often look for what would this cat's natural strategy be. And oftentimes, if they're fearful, their natural strategy would be to hide. So these are exactly those cats that would hide, but they either can't because, you know, they haven't got anywhere to hide, or because they're being brought out of hiding to say hi, or perhaps because their fear level maybe is reduces once they've started to hide. Then they come out, and then they kind of get into a confrontation or an interaction with the visitor, for example, and then all of a sudden they realize that they are quite fearful, and then they're already in the situation, and then they react aggressively. So that's fear. The other time that we can see this is when cats are frustrated. And this is oftentimes more when the aggression might be directed onto the caregivers themselves. So this could be frustration or cats being irritable, and that can have so many different underlying causes. Again, physical health, always think back to that. But it could be because the environment's not appropriate. There's either not enough space, maybe not enough resources, maybe too many other cats in the house, maybe a lot of environmental changes happening, maybe not enough opportunity for perhaps play or predation that can also contribute to frustration. So we're really looking for, why are these cats' stress levels and arousal levels rising? And there we always need to look to the physical environment, the social environment, again, back to physical health, and anything that might be happening within the cat's world to cause this frustration to rise. Now, some cats might be predisposed to that. I'm thinking about orphan kittens that have been bottle fed, for example, where perhaps their neural pathways didn't develop maybe the way that we want them to, or perhaps that are not as good at dealing with stressful situations because the maternal care wasn't there. So therefore their stress receptors, their glucocorticoid receptors haven't been primed in the right way, or there aren't enough of them. So a tendency or propensity towards high arousal and high frustration may be an early life experience thing, right? It could absolutely be that these cats are just genetically and epigenetically already predisposed to that. And then maybe throw into the mix an inappropriate physical environment, an inappropriate social environment, and then these cats are more likely perhaps to become aggressive. The other thing with high arousal cats, hang on, I've just lost my train of thought. The other thing with high arousal cats, I was just talking about early life experiences. It'll come back to me. I did talk about bottle feeding, didn't I? Yeah, I talked about bottle feeding. Oh, there was something else. It'll come back to me. Oh, yes, that was it. Redirected aggression. Thank you. So redirected aggression is something else or another type of aggression that is often focused towards the caregivers. And this is oftentimes a high arousal state that the cat finds itself in because there is some other trigger in the environment. And this is really typical when we have garden cats, neighborhood cats, cats that come and kind of, look through the window from the outside in, and your indoor pet cat sees that, they become highly aroused, extremely stressed, and then they kind of redirect that behavior onto either another cat that's living within the home, another pet that's living within the home, or maybe the caregiver. So those are really relatively common situations, I would say. So redirected aggressive events, and there's been a little bit of research done on that. Often when the cat sees another cat, and that's usually this outdoor cat, it could also be, though, as a result of a stressful event within the house. And it's oftentimes a noise event. So a high-pitched noise, for example, or it could be, I don't know, somebody dropping a pan and it's shattering really loudly, or something dropping within the home. And then this high arousal, the cat goes into this high arousal state and then redirects that emotion towards a person, another pet in the home. The same research found that visitors, that could also be a trigger for redirected aggression. Other pets in the home, smelling something, an unfamiliar odor can cause this high level of arousal that can cause redirected aggression, or being outdoors. So a cat that is all of a sudden, that goes outdoors and has this kind of massive sensory input that results in high arousal, that can then lead to a redirected event. So I would say frustration, either because of inappropriate environment, social relationships, maybe inappropriate early life experiences. Sometimes frustration can also come from a cat that is being put into a situation that they're perhaps not necessarily, maybe haven't adapted to. So I see that here in the UAE a lot. We have this huge population of street cats that are really well adjusted to a life on the streets. And then something happens, maybe they get sick or they get injured, and they're taken in by a well-meaning human being, but they're then taken in and kept in a home even after they've convalesced. And that home might be a one-bedroom apartment in a high-rise building. And then that environment is so very different from the environment that the cat has lived in for all of its life. So going from being a free roaming street cat to going to living in quite a small, comparatively space, and that can cause frustration as well. So there are so many different things that can kind of contribute to that, to this high arousal frustration state. And then, of course, we've got our redirected aggression as well, which can be due to an event that causes that high arousal, and then the cat redirects. So those would be the highest risks in my experience for caretaker owner directed aggression. So we're not talking about visitors or strangers or people outside of the family. We're actually talking about family members. So those will often be those situations. And that's when the work starts really trying to dig deep into what is it that's causing this high arousal? Is it the environment? What can we do to change that? Is it the social relationships? What can we do to change that? Was there an event that has caused a massive fear response that caused that redirection? What if we have just very high propensity towards frustration, either due to early life experiences or because the cat is now in an environment that's no longer perhaps what it was used to. And so that's how we start to kind of really drill down on these frustration-related offensive aggressive events. And within that, I would also put petting-related aggression, which is another one that we see really commonly and is also usually a frustration-related behavior. And petting-related aggression is oftentimes the cats will actually come and seek out the proximity to the human. However, when they're then on the human or next to the human, they don't want the type of physical touch that the human is offering. So I hear so many times, no, but he comes and sits on me. He's the one that's asking for the interaction. Sometimes he's actually bopping into my hand to ask him to pet him. And then I pet him, and then all of a sudden it goes wrong. And then, they either turn around and bite, or they lash out with their claws, and they become highly aroused and aggressive. And I think oftentimes it's perhaps because we as humans, once they're on us, then we stroke them and stroke them and stroke them and stroke them, and they kind of like it and tolerate it for up to a certain point, and then all of a sudden they get frustrated with that interaction, and then things change. And again, here you can start to see some of the early warning signs, right? You might see a tail slowly start to flicker. You might see the pupils start to dilate. You might see the ears turn backwards. And these would all be times where I would either stop the interaction, and if things are getting too bad, I would then change the context, right? Get up, remove the cat, throw a treat for them, have a one toy ready, redirect them onto doing something else, because that's quite a high risk time for an aggressive event. I also like to use what we call the kitty handshake, or the 2 or 3 second rule, which is so the kitty handshake is where we present our index finger to the cat and see if they want to kind of touch noses with us. And then we can perhaps move on to petting around the head and neck area. But we would always recommend stopping after 2 to 3 seconds of interaction and seeing what happens. Does the cat reinitiate, or do they maybe walk off, or do they maybe just lie down and curl up, which might be an indicator for no more touch, please. So just kind of asking for that consent and sort of trying to see what the cat is comfortable with can be really, really important and very helpful. And sometimes cats just want to be close to us, but don't necessarily want to be touched by us. And that can be difficult for us, right? Because we want to touch them and all that kind of thing. So Those would be, I think, probably the most common presentations of human-directed aggression that I see. Some of them are more easy or difficult to deal with than others. I find the ones where we have this really high arousal and these really high intensity aggressive events, those can be the most difficult. And they are oftentimes, so here in the UAE, certainly, I often see these cats that are either, orphan kittens that have been bottle raised, or that have come into a situation where they just can't cope and they become hugely frustrated because of the environmental constraints or the environmental situation. I find these cats are often the ones that present in this kind of very extreme way. Now, when it comes to treatment, safety management is key. So just like with dogs, we have to really be quite vigilant about safety management, create barriers where possible. We also have to, as humans, really adjust our interactions with the cats. Give them a lot of space, try and create space, have first aid tools all around so that if the cat does start to sort of approach or is not looking great, that we can distract them with, I don't know, a wand toy or throwing a treat in the other direction, while we can create a barrier to keep everyone safe. So safety management is definitely something that's important. And then, of course, we always want to treat the underlying cause as much as we can. And we're not going to dive into it too much. I've touched on quite a few points already: resources, environment, space, letting them go out, having appropriate physical interactions with them as humans, and so on and so forth. Making sure we address physical health, treating pain, treating something like hyperthyroidism. If it's, predatory behavior, giving more opportunities for predation, as I mentioned slightly earlier. But sometimes if we have these super highly aroused cats that might come from a genetic or an epigenetic predisposition, an early life learning or experience predisposition, or because these cats are struggling to cope, then that's where psychopharmacology comes in. And I won't dive too deep into which medications I use. They're always very much dependent on the individual case. But for high arousal states, I will usually go for an SSRI, something like fluoxetine. And if it's a really acute situation and we need some first aid, I will often pair that with usually gabapentin. You could use a benzodiazepine in these cases, but benzodiazepines are probably a little bit more unpredictable. So where we want more predictability and more behavioral calming, I would go with something like gabapentin or pregabalin. Now, there are a million other options, treatments, ways of approaching this. And of course, psychopharmacology is never the only thing that we use. We need to use all of the tools in our toolbox. So that's environmental management, that potentially is behavior modification, that is absolutely addressing physical health. That might be supplements and pheromones alongside your psychopharmacology plan. It's creating realistic expectations for the clients. It's making sure that the cat's behavioral needs are being met, enriching their environment, making sure they have enough resources. So everything that diffuses that arousal. And then really looking at social interactions with other cats, with outside cats, all those sorts of things. So the treatment plans can sometimes be quite big and quite comprehensive. And I would say that these are often quite big cases. They're quite serious cases, especially where people have been injured and are now not feeling comfortable around the cats anymore, or around the cat anymore. There are definitely cases that we need to give a lot of support to, where we also need to give the caregivers lots of support, and where we want to change things quite quickly. And that might be with psychopharmacological first aid, or creating safe zones, or teaching people how to interact with the cats. So there are a number of things that we can do to create quick wins. However, I do feel that these are some of the cases that can be quite challenging and can be quite big cases, also because of the risk that's involved, right? So we always want to do a bit of a risk assessment and see what the actual risk is, both to the cat, but as also to the family and the caregivers. All right, that's been my little whistle-stop tour through human-directed feline aggression. I'm going to put in the show notes the link to my Learn to Speak Cat course, because if anybody's interested in learning more about feline body language and these emotional states, and a lot more about natural feline behavior, which is so fascinating, then my Learn to Speak Cat course is absolutely a great resource for you. Is it a 5-module or a 6-module course? I think it's a 5-module course, but it dives into all the kind of different bits and bobs, emotional states and natural feline behavior, and what can we do to optimize the environment. I talk about the 5 pillars of a healthy feline environment. I give you some of my favorite tools in terms of pheromones and diets and supplements and other bits and bobs. So it's such a great course, and anybody that wants to learn more about feline behavior, whether you are a cat owner or you're perhaps working in the veterinary field, maybe you're a veterinary nurse or a vet, or perhaps you are a behaviorist that would like to learn more about cats because they are so different to dogs, then my Learn to Speak Cat course is a really great course for you. I'm also going to pop in the show notes how you can work with me one-on-one, whether you're a cat owner or whether you are a veterinary professional or a pet care professional that would like perhaps some support on a case, or your own pet. I'll put that in the show notes as well. And I'm also going to put a link to my psychoactive course. So if you do want to learn more about psychopharmacology and which medications might be really useful to use in these cases, then I have a whole course dedicated to just behavior medications in dogs and cats. There's 11 hours of content in there, and this is definitely a course that is perhaps aimed more towards vets, the veterinary team, but other pet care professionals that want to learn more about behavior medications. This is a great, great, great course. So I'll put all those links in the show notes for you. And I hope that's given you a little bit more insight into how I would think about and approach a feline human directed aggression case. And just that they can be quite tricky to manage, but also that they absolutely benefit from really great professional support. So lots and lots of opportunities for everybody to make a big difference to these cases. All right. Thank you so much for tuning in, and I'm going to see you next week for episode 113. Bye for now.